I try to remind people what we're dealing with on the other side, because as a conservative, you tend to play nice. You want to play nice in the sandbox, and people don't understand what we're up against because the other side does not play nice. The other side actually wants you dead. And if you couldn't tell from what happened to Charlie Kirk, let me give you a couple others. Now, in the medical professional world, they are just flat out, just like they don't want to treat you if you are conservative at this point. I want to play a video first of a nurse who had, this is so disturbing to me, guys. This is a nurse who had this to say about Caroline Leavitt and her unborn baby.
My wish for Caroline Leavitt, she is pregnant with a baby girl, and I truly do hope that baby is so healthy. I hope she's healthy and headstrong, so headstrong, in fact, that as she is emerging into this world through Caroline's geriatric deck garage, that she tears her from bow to stern. Grade 4 tear. Like so big that when she gets out of the shower naked and walks across the room, like she accidentally picks up dog toys. Yeah. That's my wish for you, Caroline.
It's like, what world are we living in that healthcare professionals think that they can just say things like that online on purpose, intentionally posting it publicly, and it's just everything's kosher, I guess? I don't know, but didn't go well for her because she's no longer employed there. But the problem is much more pervasive, actually, because in New York City, police officers were refused medical help at a hospital because workers mistook them for ICE. I want to read you an ex-post from the Detectives Endowment Association. This is the labor union serving active and retired New York City detectives. They said last week, 2 NYPD detectives were mistreated while seeking medical attention at NYU Langone Cobble Hill Emergency Room after being injured on duty during the arrest of a violent perpetrator. Upon arrival, they were met with rudeness, disrespect, and a lack of basic professional courtesy by hospital administrators. It is an outrage that any NYPD detective injured in the line of duty should have to worry about being treated at any hospital in the city they protect. As nurses across the city strike over issues like workplace safety, treating detectives poorly is not how to make hospitals safer. No one, especially detectives injured in the line of duty, should face such treatment. The DEA is investigating the matter, is what they end with. And I want to bring on to discuss this. This really enrages me. I want to bring on Sergeant Betsy Brantner Smith. She's a retired police sergeant and spokesperson for the National Police Association. Thank you so much for joining me, Sergeant.
Thanks, Sarah, so much for having me.
Does this enrage you as much as it enrages me?
It enrages me and it chills me because I was a cop for 29 years and we really relied on our emergency room personnel and worked with them frequently. I myself spent a fair amount of time in the emergency room getting patched up and taped up and all of that. So for these detectives to go to the emergency room and to be treated the way they were treated, and it wasn't just with disrespect, but basically they tried to shove them out the door and not treat them, and all because they thought they might be ICE agents. I mean, this is the absolute insanity that we live under at a time when 93% of the legacy media is reporting negatively about ICE. And this is, as you can see, is starting to trickle down to other law enforcement as well as to law-abiding and conservative citizens. And it's insane.
Yeah, it really is. And the problem, especially in New York City, is that, I mean, who do you trust to handle the situation? The new mayor? I certainly would be terrified if I lived there that, like, what, the new Muslim commie mayor is going to suddenly fix the situation. We pull up tweet after tweet after tweet of his old posts where he's saying defund the police. He actually doesn't like the police. So it's like, who can NYPD trust to protect them and stand up for them? And what does that mean for the workforce? Because you got to believe that the good cops, the good ones that are close to their pensions are like, I'm getting out of here as soon as I can. And who are they going to be replaced with?
Well, and that's the thing. We're going to continue to see this mass exodus of not just NYPD, but LAPD, Chicago PD, all over this nation, because, from 2020 on, the American law enforcement officer, especially in these large blue cities, is tired of being demonized and vilified. And they're tired of not being able to do their jobs. And up until this latest ridiculous situation where ICE and other law enforcement officers are being attacked, we had started to see that pendulum swing to people were supporting law enforcement in this country because they saw, especially in the bluest of cities, in the worst of neighborhoods, people saw that the demonization of their law enforcement was having a negative impact on them and their safety and their ability to just go about their lives. So now here we are, we're back to hating cops. And now in New York, you've got a cop hating mayor, a cop hating administration. And I'm so glad that the Detectives Endowment Association spoke out about this. And we all need to speak out of this and continue to support law enforcement, or we're not going to have any left.
Yeah, you're absolutely right. And, you mentioned on top of this, the increase in the violence against law enforcement, because there is, of course, the media coverage that is the overwhelming majority is negative. And you've got the increase in violence against law enforcement, but also something even scarier than wishing harm upon people, coming from the left, but it's coming from liberal white women. I just have to say, I saw this from Fox News. Assassination culture is on the rise, especially among women, study warns. And so now it's these liberal white women who are the majority when you look at the categories of people who consider political violence as justified. We see them out in Minnesota. They're going out, they're bringing their babies as like human shields, I guess. They know that it could be dangerous, so they're bringing their children and they're like putting them in their infant sling right in front of their chest. I mean, this is really dangerous stuff.
Well, it is. It's a culture of death.
Yeah.
When you bring your child to a riot, to a situation that is going to be dangerous, and you do it because you want to make a statement, it seems as though they're hoping these kids will get hurt so they can say, oh, ICE hurt our kids, law enforcement hurt our kids. It's absolutely extraordinary, and it's dangerous. And they're lying about what law enforcement is doing. And they're teaching their children, just like so many of the teachers we're seeing, they're teaching their children to be afraid of law enforcement, to hate law enforcement. That ultimately becomes dangerous when at some point these young people, these kids need a police officer and they're too afraid to speak up and speak out because they have been told cops are the enemy.
Mm-hmm. Yeah, and that's a very dangerous and scary world that we start living in, because that's total chaos, which the left conveniently will love, actually, as it turns out. Sergeant, tell everyone where they can find you. I think we have your X account.
Yeah, you can find me at SGT Betsy Smith, Sergeant Betsy Smith, and you can follow the National Police Association at Nat Police Assoc. We're at nationalpolice.org. We do a lot for the American law enforcement officer and for people like you who support us.
Great. That's wonderful. I appreciate you. I appreciate all of your service, and I appreciate you speaking out. We need more people in this profession speaking out and speaking truth. So I appreciate it, Sergeant.
Thanks for having me.
Thank you.